our rates are relatively low, and it's because of the whole community responding, all of Kentucky responding with the social distancing pieces. My wife tells me that men mainly have just learned how to really wash their hands correctly. So we're it's made a difference, and you can see that's why the numbers are important. You can see that it's made a difference.
So what role, if people are tuning in and they say, okay, this guy is the Cabinet Secretary for Health and Family Services, what role do you play as we look at this global pandemic?
So the cabinet is a very large organization. I think the total budget now is over 12 or 13 billion dollars. There are about 7,000 employees across the state, and so we have Medicaid, we have public health, which a lot of people have been hearing about, local health departments. We have behavioral health, and all of those folks with developmental and intellectual disabilities that we serve. Department for Aging and Independent Living, Family Resource Centers, all sorts of different agencies that come under one cabinet. And so my job is to try to keep everybody coordinated and make sure that we're all putting our oars in and going in the same direction.
So the Kentucky Cabinet for Health and Family Services, of course, under that umbrella is local health departments, and they are on the front lines of this pandemic. So what would you say to the people of Kentucky as we watch this COVID-19 pandemic unfold?
Well, what I would say is we'll get through this, and we'll get through this together. And in the cabinet, I've also added, and it's the only way we're going to get through this, right? So having to think about how we respond as a community, how we respond to epidemics and pandemics. Actually, that's the role of local health departments and public health. They have been trained. You've heard about contact tracing and how we engage with communities and try to kind of track disease. That's what our systems are built to do. Not at this scale, and we've underinvested for years and years and years. But that's how we're supposed to respond. We're supposed to respond through our local health departments, and I think we have.
How would you, or what would you say to the people of Kentucky as far as those numbers? Why are they important?
Well, the reason they're important is if you look at our response, and we were really an early responder, and the governor has been a tremendous leader here and willing to listen to his public health commissioner and the science on this. But if there's some websites that I follow, there's one that's kind of COVID-19 spelled backwards, and you can really look at not only worldwide responses and which countries have done well, but you can also look at which states have done well. And if you look per population, if you look at those numbers about who has tested positive, Kentucky looks great. I mean, we are in like the categories with Hawaii and Oregon and other states that we're not normally associated with, but we are in some ways leading the country in terms of our response, or among the leaders in the country in terms of our response for, I think the governor says, knocking the top off the muffin. Our rates are relatively low, and it's because of the whole community responding, all of Kentucky responding with the social distancing pieces. My wife tells me that men mainly have just learned how to really wash their hands correctly. So we're it's made a difference, and you can see that's why the numbers are important. You can see that it's made a difference.
Okay, Secretary Friedlander, we do this with all of our guests.
Mm-hmm.
If you had the opportunity to sit down and have a cup of coffee with anyone living or dead, don't think too long, who would that be?
You know, it would be Martin Luther King. His wife graduated from the college that I went to, and his whole concept of inclusion and nonviolence, I think, is something that we need today.
Cheers to you, Secretary Friedlander.
Thank you, and cheers back.